ABC Action News is streaming breaking news.
That breaking news is happening right now in Palm Harbor. Governor Ron DeSantis is making an announcement related to health care. Let's listen in live.
Had not been implemented yet, and so I directed Mary Mayhew to expedite the development of the Transparency Web tool so that it would offer facility-level pricing and quality information for the most common healthcare services. And so today, one of our announcements is that the Secretary has accomplished her mission. As of this morning, for the first time, Floridians can go to www.floridahealthpricefinder.com and find average prices at the facility level for the most common non-emergency healthcare services. And so, we think that this is a powerful tool that can be used as we look to innovate in healthcare and to save costs. I think most people, what they want is they want, high quality care, but they want it in the most cost effective way. And so that's what we're trying to do. But if you look around, in Tampa, for example, costs for knee replacement range from $33,000 to $54,000. That's a difference of $21,000. In other areas of life, you probably wouldn't have that unless there's just some obvious benefit for quality. But it's not clear that a patient would really have an ability to discern that based on kind of the old system. And so if you have a certain percentage of deductible that you have to pay, that's obviously a lot of money. Anyone who's using health savings accounts, that's a huge amount of money. Miami-Dade County appendectomies range from $13,000 to $23,000 in terms of claims paid. Orange County rotator cuff repair, I've had that, $15,000 to $25,000. So these are just a few examples. So FloridaHealthPricefinder.com, if people can go, then they can look. Now, I want to thank Chris for doing this. But I think the transparency is just one aspect of that, and we're happy to move forward with it. But the fact of the matter is, if the difference in prices is going to be borne by a third-party payer, the consumer still doesn't have a full incentive to really go and do this research on the front end. And so one of the bills that we were able to get enacted this past year was a Patient Savings Act. We're actually using it with some of our state employees, where when you use a transparency tool like this and then choose something that's more cost effective, you as a patient actually save by, for example, getting rebates on your insurance premiums. That then gives the patient the incentive to look for what makes the most sense, both in terms of health and in terms of cost. So we've moved forward with that. We're working with some of the insurance plans to offer that. I think it's been successful so far in the state, and I think that that's a model that can be expanded beyond here. The other announcement is, we have the new portal, but I'm also announcing today that in the spirit of promoting transparency and innovation in our healthcare system, we're establishing the Governor's Transparency Award in healthcare. And so this award will be granted to one hospital or ambulatory surgical center per year for demonstrating excellence in price and quality transparency. And for each winner, we'll do an event, put their logo on ACA's website, and make sure Floridians know who is going above and beyond to make healthcare accessible and understandable. And so we'll open a 4-week application period beginning this week, and I encourage all interested parties to apply. And the third announcement, and one of the reasons why we're here in Walmart, is I'm asking Secretary Mayhew to engage employers throughout the state of Florida to find ways for collaboration so that they can do what Walmart is basically doing, promote transparency and adherence to evidence-based medicine. What Walmart is doing now with their employees and their plans is they're providing information on the different providers in a given area. And part of it is based on cost, part of it's based on quality, and then part of it is based on, are you doing things that really you don't need to be done? For example, I was reading some of the things. There was a number of people who initially were told they had to have surgery, but then there were other ways to be able to treat that. And so the patient ended up getting treated better. Obviously, you don't want to have surgery unless you absolutely have to, but then the costs were much less as well. And so Walmart is doing this from the employer perspective, and we want to work with other employers throughout Florida because I think that there's a lot that can happen if the employer community is on board for this and understanding that, patients just need information, and this has been a very opaque system for so long that what Walmart's doing to provide information, what Sproul's has done and Mary has done by getting this portal up, what we hope to do more and more with the patient savings model, that is starting to move, I think, in a better direction and bring some sanity in this. So we want the healthcare here in Florida to be transparent, affordable, and high quality. So people want to go look, floridahealthpricefinder.com, and I think that this is a step in the right direction. And so with that, I'd like Secretary Mayhew to say a few things.
Well, thank you, Governor. I think this really fits into the category of something's got to give. And because of Governor DeSantis' leadership and his sense of urgency, he has truly made it a priority to lead and to drive change in Florida's healthcare system. And Speaker-designate Sproul's similarly passionate about getting good information into the hands of consumers. When we think about today, in this day and age, what we have at our fingertips for price comparisons, what this store, what Walmart does, when you are shopping for a house, when you are shopping for car insurance, it's all right there. And yet, for some of the most significant costs that we may incur for healthcare expenditures, we've been in the dark. And so I am so excited that today we have now made, through, again, the leadership of Speaker-designate Sprouse and Governor DeSantis, we are making this information available. And it's important not only to getting that information timely in the hands of consumers, but it's going to lead a lot of other people to ask questions about why. Why the disparity in these prices? So that also helps to drive accountability in this system. People are paying a lot out of pocket. And as the governor said, we've got to restore some sanity to this system. So truly, we want today to be about enforcing the importance of this information, driving people to this website, and making it have a difference and an impact in our system. The Transparency Award is intended to motivate and to incentivize innovation. No one needs, when you are in need of access to this information, you shouldn't have to be chasing down multiple sources of information, much like when we think about the transformation that has occurred in transportation and that Uber experience that we all know about today. You should have that same opportunity to find information about the cost of healthcare. I was a patient recently in Florida, and like so many, now mine was a bit of an emergency, but nonetheless, after 48 hours, I got a $54,000 bill. Now, thankfully, I wasn't paying all of that out of pocket, but nonetheless, we need clearer information so good decisions can be made and we can improve the affordability of health care. And in terms of the governor's direction to me to engage with other employers across this great state, Medicaid is a huge purchaser of health care in this state. $28 billion a year spent on health care for nearly 4 million Floridians. The state employee health insurance plan, providing coverage to so many Floridians, and then partnering with employers across this state to move the needle, that through our collective purchasing power, we can promote high-quality, affordable care by moving the healthcare market to reward providers who are adhering to evidence-based practices, clinical protocols supported by research. Because again, we want people to have access to high quality care, but we have got to take a look at all of the unnecessary expenditures across the state, across this country, that are driving up the cost of health care for everyone. So again, I am grateful to the governor for his leadership and to Speaker-designate Sprouse for what he began several years ago. Nice to finally have it come to fruition. Speaker-designate?
Thank you, Governor DeSantis. Secretary Mayhew and Speaker Designate Sprowls for your support and your leadership in transparency in healthcare. Like you, Walmart wants to make healthcare simpler and easier to navigate by creating an experience that is transparent and easy to understand through technology, data, and access to experts. I've had the pleasure of working with Secretary Mayhew and her fantastic team to discuss creative strategies to improving healthcare access. Walmart is committed to making quality healthcare more accessible and affordable for associates, customers, and the communities we serve. You may not know this, Walmart serves 160 million people a week. We insure more than 1 million lives in the United States. Our ability to impact associates and customers' lives by providing quality health and wellness services is unmatched. We believe in helping our associates and customers access this quality health care right here in their local communities. With public-private collaboration and this administration's commitment to access to quality care, the best place to save money and live better will be the great state of Florida. Thank you.
Well, thank you to Walmart, to Governor DeSantis, to Secretary Mayhew. You know, the reality is, here we are. I love the backdrop of being here at a Walmart today, because just a few aisles from here, you can go shopping for paper towels, and they got 50 different kinds. And they all have a different thickness and a different quality level and a different price. And the reality is that's true of paper towels, and it's true of most of the products that you could get here or any other retailer, but it's not true about healthcare. And it hasn't been true about healthcare for a very long time. It's one of the only areas where we ask our consumers to purchase and then find out what the price is later. Imagine if we got on Amazon right now and went to purchase something and they said, well, you purchase it first, give us your credit card number, we'll let you know how much it costs afterwards. None of us would make that purchase, and yet we do it every day in healthcare. The reason that we started this project 3 years ago was to bring that to a screeching halt, to let people know that the price and the quality of the consumer product that is the delivery of healthcare should be something easily navigable, just like looking up the price of paper towels. And that's why we went on this project 3 years ago to make sure that we have billions of lines of healthcare data delivered directly to a consumer, regardless of where they are, about the price and quality of your most common medical procedures at your facilities, not nationally averaged, but locally granular in your own community, so that you can begin to shop. And people say, well, why does that matter in a world where we have health insurance? A lot of people have health insurance. Why does it matter what they cost? More employees year over year and more employee health plans year over year are going into high deductible plans. Cost matters more than it's ever. Quality matters to our families. And the reality is that unless you know somebody who works at a hospital, you probably don't know how good the quality of care that you'll get when you walk through those doors. This seeks to bring those things together, to bring cost and quality together. But the reality is, I always tell people that you can do something, you can pass a law, and sometimes that's hard. Implementing that law is even harder. And for 3 years, we wanted to build this information superhighway to allow the marketplace to respond, to allow patients to respond to cost and quality. But the construction vehicles were there and nobody was working until Governor Ron DeSantis came in and said, patients in Florida have waited long enough. And he and Secretary Mayhew went into overdrive 24/7, where ACA has been implementing this, making sure that the stakeholders understood, that the timelines were certain, that they had to deliver this product, and today we're happy that they have. You know, this Health Finder website will not only give us just health, costs and quality information to our patients, but it also builds on the other things that we put into law over the last couple years, including protecting patients from surprise medical bills, so that they're not surprised after they've had a procedure and they don't get that bill that puts their family at risk. This is a huge deal today. We appreciate the market players like Walmart and others who are going to use this information superhighway to deliver great products, to deliver great cost information and great quality information for our consumers. So again, thank you to Governor DeSantis and to Secretary Mayhew.
So what ends up happening, I think it's about 44 different procedures where we have the data on that would require some admittance to a hospital or an ambulatory surgery center. And then I think there are many more for things that would be more routine, that maybe just would require a visit to a doctor's office. So I think that's going to be useful information. So I look forward to continue to working. And then just finally, I have to say, I had a bet this weekend on the Florida-Georgia game, and obviously, I was rooting for the Gators, and so I made a bet with the governor of Georgia, and if we had won, then he was going to have to come down to the Everglades and hunt these Burmese pythons that we're trying to get rid of. But since we lost, I got to go up to South Georgia and hunt these feral hogs that are turning everything up. So I don't know when that's going to happen, but if you see me in South Georgia doing that soon, you'll know why. So, anybody have any questions?
Okay, so you were just listening to Governor Ron DeSantis. He's actually at a Walmart in Oldsmar, really announcing some new initiatives about healthcare, really finding high-quality care with the most cost-effective way. One thing he made an announcement about was the website called Florida Health Price Finder. It's actually live right now. Basically, it breaks down the best price for non-emergency care. He also mentioned a few other things like a transparency award to really get the most transparent, cost-effective, excellent healthcare to all of us in Florida. We're also following other breaking news this hour. Right now, Pinellas County deputies told us about an explosion at a bank ATM in Oldsmar. They tell us it happened around 3:30 this morning at the BB&T Bank. It's on Tampa Road. And as we speak, deputies are on scene. Right now, they haven't reported any injuries. We'll keep bringing you updates on this throughout the day right here on ABC Action News streaming now.